all of you have finished speaking. I don't think there's anything much for me to do. I really appreciated each one of you, the way you all spoke. I don't think I'm a very, very simple woman who cannot even understand some of the words that you all spoke. And I can only talk about medical. I only know medical, I only know gynecology. And I wish I was with all of you to understand what you all spoke, but every talk was inspiring. The panel was so beautiful. Even the simple psychological things she gave examples were so good. And I'm here to talk to you about myself, how I became a gynecologist. And most of you who are here know me, and either I have delivered your sister's daughter or sister or whatever it is. I feel very old. I think I am the oldest here, probably nearing 70. And I'm very happy, but I feel old as of today. But then looking at all of you, I feel I should work some more years. And as a young girl, I never dreamt to be a doctor. I just wanted to be a housewife because those days that was what was very interesting. Wanted to be a housewife, wanted to deliver children, look after the children, and then bring them up. Bring them up. I had some dreams of bringing them up, so I just thought I should be that. Then when I came to plus two, when I got a good percentage, my parents said, "Why are you wasting your time? You should do something better." So that's how my father, I just wanted to be a teacher. In fact, I liked the teaching profession. I wanted to be a teacher. So I told my father, put me into BSc B.Ed course so that I can become a teacher. So I joined Mysore college where there was a BSc B.Ed course. And when my father, without telling me, he applied for medical college because the percentage was so good, he wanted me to do something better. Then when I got the seat in Mysore Medical College, my father came and said, "Why are you sitting and doing all this, physics workshop, the chemistry workshop? Come on, you are now going to become a doctor." I said, "No, I'm still interested in this physics and chemistry. I want to finish this and then come out. I don't want to. I'm feeling sad that I'm out of this teacher's job and then I'm getting into medical because medical was something that I never dreamt of." So that's how I got into medical, and then I finished my MBBS in Manipal. Basically, I know only Kannada. Tamil was something that I learned after my marriage. So when I went to gynae was also not my subject. I wanted to become a great surgeon, a urologist, but didn't end up doing that because my gynec professor knew me since my childhood, and when I gave the form for doing MS surgery, she just tore the form and threw it at my face. And she said, "Why should you become a general surgeon? All these men who have hydrocele and all problems don't come to you, they only go to the males." So she just threw the form. She herself filled the form for me and made me a gynecologist. So that's how I ended up being a gynecologist. And I have been a gynecologist since 1979. So I have probably delivered more than 1 lakh children. And I find pleasure in seeing each and every delivery. I see a child, I find happiness. That is my happiness. Because sometimes, people say, "How is it you're going on delivering and don't you feel tired?" Our tiredness goes when I see a small child being delivered, seeing the happiness in the father and the mother, seeing happiness in the family. We feel so nice. At the same time, we also have some happenings which are not good on their side. And when we see them cry, we can't sit and cry along with them, but we can only sympathize with them. So there are so many emotions going on in our medical field, as most of the patients don't understand us. If something goes wrong, our kairasi nalla illa, kalrasi nalla illa, because they would make lot of mistakes. But then they would say, அவங்களோட கைராசி நல்லா இல்லை, நாம் வேறு டாக்டர் கிட்டே போகலாம். When something goes wrong there, then they come back to us again. Oh, your kairasi is still good. So this is what happens with the present day. And then the present generation, the patients who come to us, they want us to go on talking and talking and talking and talking for hours together. They don't want to actually know what is wrong with them. You tell them in a simple 2 sentences, see, this is what you have. You need to do this. You need to do this. They're not happy with that. They will put it up in the Google review. Oh, when I went to this doctor, she just stopped with 2 sentences saying, I have this problem and I need to do this. She never gave me elaborate discussion on this particular problem. Where is the time? There were days in Kupsami Naidu Hospital when I used to see 150 to 200 patients a day. I just had 1 minute for each patient. And I used to say, you're fine, patients would be happy. But it is not now. The generation now has changed. They want us to talk for 1 hour. Now today, I'm able to see only 15 patients in a day. Because I have to speak to them for 1 hour. And the same thing, you keep on telling them the same thing. So generation to generation, there is so much of change in the type of delivery, so much of change in the checkups. There are many changes that has taken place from what we had those days and what it is today. So today, we have a lot of problems to look after a couple. Those days, it was very nice because they made us feel a part of their family. But now it's not so. You are a doctor, I have paid you, you are not supposed to do this work. That's how the mentality of a person is today. So let us come to the reproductive health as such. Now we all know that late Jawaharlal Nehru said, to awaken people, it's the woman who must be awakened. Once she is on the move, the family moves, the village moves, and the nation moves. That's true. And I don't blame the men. Men these days are very, very supportive to the females. I have seen couples where they have equal responsibility, they do well, and don't make them all feel small today, even though it's Women's Day. They are equally helpful to us. Next slide. So we have different phases of life. Childhood and adolescence, then midlife, and then you come to premenopausal and the menopausal age group. Now, there are a lot of things that we need to see in the adolescent, childhood and adolescent. I think Akila has spoken very well on childhood and adolescence, and really, it was a very inspiring talk by her. Childhood is something that we have to really, really concentrate, and it is the parents and the teachers who need to do it. I do agree with her saying that it's just not the teachers, it is also the parents who have to reshape the child to make the child more mature and more understanding of its future. So what is that we need to do at the childhood level? Definitely, I am happy that most of the teachers have been teaching them what is a bad touch and what is a good touch. You ask a kindergarten LKG child, the child tells you. I still remember just 2 days back, my personal trainer's son, he is just 4 years old, and she was teaching me. It just so happened that her t-shirt was a little low. So immediately the son says, Amma, and the t-shirt sariya potko, bad touch, not nice to see. See, he's only 4 years old and he knows what it is. So the bad touch and the good touch is something that you need to teach the child in the childhood phase, and it is very important. A lot of stories that have been going on in our India, and I don't have to go through that again. And what is that we need to do to look after the health of this child? And most of the women parents who are busy, they just look for Swiggy and Zomato all the time. That should not be so. You should give them a healthy food, so that, because the incidence of obesity is increasing, and I'm sure most of you are seeing in your own schools and colleges the way the small children of 2 to 5 years of age being so obese, sometimes they are some 50 kilos, 60 kilos at the age of 5 years and 6 years. And when there was a lot of studies done in the schools, and they found that the blood pressure is high in such children. The lipid levels are high, triglycerides are high. Some of them have become diabetic at that age. We see small children having diabetes, small children having high blood pressure, which was never heard of when we were all in the school, because we had good time to go and play. Now I'm sure even if there is time given for play, they would sit down and then look at the cell phones. There should be some time to give a play so that they use their muscles, at least be more healthier. And as far as the vaccinations are concerned, it's very important to vaccinate the child against a lot of diseases. Most of the vaccinations are over by the time they come to the school, and around 9 years of age to 12 years of age, it's very important for all girls to be vaccinated for the human papilloma virus, which is one of the causes for cervical cancer. Now, cervical cancer is the second highest cancer. I will go into detail regarding that in the next few minutes. So, if you start giving vaccination for these girls at the age of 9 to 12 years, a single injection. Now, there are two varieties of HPV vaccinations, a quadrivalent vaccination and a nanovalent vaccination. A quadrivalent vaccination, which involves only 4 viruses, whereas a nanovalent involves vaccination against 9 viruses. So, if you use a single dose of nanovalent vaccine, that should be enough. So, for a cervical cancer, which is the second most important cancer in India, it's better we vaccinate these young girls between 9 to 12 years. And after 12 years, it is 2 doses up to 26 years, and then 3 doses later. Then the women who are married and had children can also be vaccinated. The severity of the diseases go down, but the ideal age is before marriage. So the girls, see, this is the age where the girl's kindergarten life reflects her personality throughout her life. Habits and behaviors in young age will influence overall health. Most impact with the young girl by giving her information, guidance, and resources. So this is something that we should discuss with the children. I mean, you can't say, "Nee chinna konadhe onnu nee pesa vendam, nee unakku onnu theri vendam." That's not what we should do. If the child is anxious to know about something, it's better we discuss with the child about it. So the parents play a major role for a healthy future. So staying fit, fitness means having energy and strength to do more also feels good. Being fit makes you healthy, help fight diseases, helps you sleep better, handle stress better, and keep your mind sharp. So thumb rule is fit. And half the chronic illnesses is related to lifestyle and behavioral factors. Most of the premature deaths could be prevented by modifying your lifestyle behaviors. A balance of weight training, lower intensity cardio, sleep, and adequate food intake, including carbohydrates, fibers, and fluids, is the theme of. So, message to you all: health is not merely the absence of the disease, it's a lifestyle. Whether it's getting enough sleep, relaxing after a stressful day, or enjoying a hobby, it's important to take time to be good to yourself. Take steps to balance work, home, and play. Pay attention to your health and make health living a part of your life. Take care of your body. It is the only place you have to live in. Thank you.
Thank you, ma'am, for your experience.
I'm happy that the schools and colleges have also started the Women's Day. So that the younger generation also realizes the importance of women, So thanks to all the principals for having started Women's Day. I know Women's Day every day is Women's Day. There's hardly any Men's Day. But then, you have to celebrate like this. Well, I would never have known any of these if there was no program like this. And I thank Mr. Brahman for having conducted this program and introduced myself to all these people. And I'm very, very happy to meet all of you. And thank you for the program.